Welcome back, everyone, to round two of my interview with Dr. Steve Darley on the Lifestyle Practice Podcast. Appreciate you coming back, Steve. We had a really good time last time talking about your transition to 3 days a week, and you've been really impressive as far as asking questions and being really open to talking about limiting beliefs, barriers, mindset. So, appreciate you coming back for one more and being able to kind of share some of your experiences.
Yeah, thanks for having me. Happy to be here.
So, the one thing that we got into a little bit last time was your thoughts with making the decision to go to 3 days a week. And I think you talked about even how, you were afraid that your staff would think, if you were going 3 days a week, that they would have it like judgments of like, oh, he's lazy or he's not willing to work hard. We'll kind of go some different directions as far as mindset and stuff, but maybe start us off as a segue in that regard. Do you now that you've kind of thought through that and seen your staff's response, do you think any of them ever had that kind of thought as far as you being lazy?
I don't think so. I think they know how hard I work, and I try to always set a good example. I'm always trying to be a good leader and be there early and leave last on the days that I do work. And I hope not. I hope they don't feel that way, I don't think they do. So I don't know why I felt that way leading into it, but to answer your question, no, I don't think so.
Yeah. I don't know. It's interesting because for me, when I kind of think through thoughts like that, I kind of think, okay, I have learned to evaluate my thoughts the same way that I evaluate a financial investment or my time and energy, where I kind of think, okay, what's the ROI on this? So I think, if I look at that thought and just say, what does this lead to? How does, what do if I have this thought and belief, what other thoughts does it lead to? What actions does it lead me to taking? What results does it get me? So sometimes, even when I ask that question of like, do you think your staff ever had that thought? I'm not sure that, me even asking that question is super valuable. You know, because if your staff have that thought, how valuable of feedback is that? So again, it's this process, evaluating, each individual thought. What other thoughts does this lead to? What actions and results? Where does this get me? So let's transition. You've been pretty open and transparent in our coaching sessions, and kind of as we've talked about a lot of different things with interactions with staff, interactions with patients. So talk a little bit about your thought process, or what you've learned recently, or how you've changed as far as interactions with patients and diagnosis, or amount of money when you're presenting treatment options.
Sure. I think for me, coming out of dental school, the hardest skill that I needed to develop was the ability to tell the patient exactly what I thought about their oral health. And in the beginning, I worked a lot on this with Justin. I would send him clinical photos and x-rays for him to try to help me treatment plan. But then during that process of doing that, if sending him photos and x-rays, most of the time I knew what the right answer was, right? Like the reason I decided to send these x-rays and pictures is because I knew the answer and I wanted basically him to tell me, okay, I agree, or that's what I would have done. And realizing that the main reason I was not diagnosing the way that I thought that I should is that I was afraid of what the patient may think, or afraid of denial, I guess, or of the patient just reacting in a way that, I didn't like, or become confrontational. And working on that slowly, the first step was just recognizing, okay, how should I be diagnosing? And I've talked to you about this as well, just about diagnosing in a profitable, predictable way is kind of how I would like to practice dentistry. And so the next step was really, once I realized that, step one is I want to practice in a profitable, predictable way. Um, the second step was realizing what my barrier was to that. And I was telling the patient the truth um, about what I thought they needed, regardless of how many crowns they got that year or whether I thought they had money or did not, or any outside thoughts that may creep into my mind during that exam. Maybe I just cemented a crown on them last week, and they came in for the recall exam and they need two more. It's easy for me to sit there and be like, okay, I think I should just wait. We just did a crown. I know they gave me a hard time about the price the first time I told them they needed a crown. I really don't want to have that conversation again. I'm kind of running late. I'm just going to put a watch on these teeth instead, and we'll address it next time. I always kind of valued Justin's honesty and your honesty now, about being able to tell the patient, like, this is what you need, and do it in a sympathetic, empathetic way that you're building rapport, but in a professional way where you're saying, Miss Anderson, I know this is not what you want to hear, but unfortunately you have two crowns that have cavities underneath them. And the best thing to get these teeth back to health is to replace these crowns. That's hard for me to do, especially when I'm thinking about other things. Maybe I'm running behind in my restorative column, or anything else that could happen day to day. So working on that constantly has been hard for me. It's been hard to kind of get over that hump, and it's a constant struggle for me every day to diagnose exactly everything that I see. And so did you find it hard in the beginning to get over that as well, or how did you kind of get over that hump?
Yeah, that's a good question. Honestly, so as I was listening to you and I'm thinking about, you talking about sending Justin photos and x-rays and stuff like that, and how, you sent them because you already kind of knew what you already felt relatively confident about it. Um and I was thinking, yeah, isn't that the case? Like, almost for the most part in dentistry, like, I would say the vast majority of the time we're relatively confident on, what a pretty good clinical approach is, what we would recommend, like, what we would do if it was our mouths. Like, it's relatively straightforward the majority of the time. But what the challenge is how to communicate that. And for me, I think I've always been very interested in communication, and I've always been really interested in why people think what they think, how they develop opinions, how they make certain decisions. So that's probably maybe been more of a stronger suit for me. I've enjoyed reading books about communication and leadership and stuff for a long time. So for me, when I started out, honestly, the bigger challenge was clinically. It was, like, I had no experience other than dental school and like online CE stuff, and like a lot of dental town, looking at how other dentists treatment plan and trying to kind of put everything together. And when I just went straight from dental school to private practice, owning my own practice. And dental school, it's like I've got I've got like forever. I've got like 4 hours to think about this one patient for and come up with a treatment plan. And then I'm in practice, and I have 20 minutes to come up with an exam and treatment recommendations. So by and large, for me, like, the challenge was that. But as far as I guess, to answer your question, as far as in regards to communication, the challenge for me was learning to be a little bit more direct in my recommendation, because I started to realize that I was kind of giving too many options, and I was leaving patients confused instead of guiding them or saying, and if this is what's important to you, this is what we need to do. but what is important to you? So I wasn't really good at asking those questions, understanding the patient, how they make decisions, and then providing them a good path forward.
Yeah, I really liked your episode. I think it was a recent episode you went into that about how that story you referred, you had a patient go to a neighboring dentist, and the dentist contacted you and said, "Hey, I just want to let you know, the patient seemed like they weren't confident in your decision." And I do that a lot of times. After that, I listened to that episode. It's like, man, I've been working since I heard that episode. I really work hard on letting the patient know, like, hey, here's option number one. Here's the best option, and kind of branch off of that to see what they say and how we proceed. So that helped me a lot hearing that from your last episode. But I would agree. I think I have that same issue sometimes.
So, what helps you in those situations when well, I mean, you talked about that kind of like the fear of what patients will think if you diagnose too much, or something that you may think is overwhelming to them. How do you work through that?
Yeah, that's a good question because I think it changes per patient, right? Depending on how the patient, their demeanor and how they're acting. So I think it depends, whether they went to a dentist 6 months ago and that dentist said everything looks great, or whether they haven't been to the dentist in 10 years, kind of changes my approach on that. But I've tried to approach it from a more just objective and honest point of view. You told me about Ray Dalio's book, Principles, and he talks about, I just started reading, I'm about halfway through, but I can relate it to a principle he had in there about transparency. Like, I forget the exact term he uses, but basically just trying to be 100% transparent in everything, to try to not only be vulnerable and show the patient that you're being honest with them, but to learn from their perspective why they may not want to go through with treatment. So I've been trying to just take a photo, and I did this the other day, is kind of take a photo and let them know, like, hey, you know, Mrs. Jones, you have these fillings up here. They don't look great. Uh, there's no obvious cavity here, but I have a feeling that in the upcoming months, maybe 6 months to a year, that they'll develop a cavity and need to be redone. Would you like to go ahead and do those now, or do you want to wait, and kind of put it in their court? If I'm a dentist, if it were me, I would do it today. But what would you like to do? And kind of just be honest with them and say, there's no like cavity right now. It's the fillings are still okay, and they may be okay for 6 months to a year, but it looks like any day now they could fail. So for me, that's worked. I don't know if that's what you did or if that's the appropriate response, but that's helped me a lot. Just kind of step back and look at it objectively and involve the patient in the decision, instead of saying, "Hey, you need two fillings up here. Let's schedule them." Kind of getting them involved has taken the weight off of my shoulders and kind of allowed me to relax. And I don't care whether they get it done or not. I'm just letting them know this is what I think in this situation, and that's helped me.
Yeah, I love the term from Ray Dalio's book that you're thinking of is idea meritocracy, and just the principle of, it's like radical honesty, transparency. It's sharing your opinion and not being afraid if someone disagrees with you. It's a willingness to share and listen to others. So yeah, it's been my experience as well that some of the most enjoyable interactions that I have with patients when it comes to treatment planning have been being honest, like you have, and then saying, asking questions. How important are your teeth to you? If you were missing a tooth here, do you think that would bother you? Or is there do you find yourself like guarding your smile? Like, are you ever self-conscious of your smile? The more that you can kind of ask and really listen and understand. One of my favorite things is to share a viewpoint, share a recommendation or whatever, and then to just say, what thoughts do you have? What are the concerns and questions that go through your mind when I explain that? And that's a much more open-ended question, and it's much more inviting than simply saying like, all right, yeah, that's my recommendation. We'll put it on the computer. Do you have any questions? That's I'm kind of I'm guiding the patient, right? Like, so if I'm very quick, I'm very short, then I am guiding the patient. I'm setting the tone to have quick, short interactions and not really trying to promote openness and honesty. And those are the types of situations where you actually increase your cancellation or no-show rate. If you're, if they're quick and short, you kind of pressure them, you get them to the point of scheduling. Those are the ones that are going to have probably not as good outcomes. Even if they do show up, they don't feel like they've been able to be heard and kind of talk through things as much. So yeah, I appreciate you sharing that, because I think that brings up a really valuable point. And again, it's one of those things that's like, it's very small it's very small as far as our interactions with patients, but it can lead to much higher patient satisfaction. It leads to patients feeling like they're heard, and so that even when you make a treatment recommendation, they feel more confident in it, rather than when they haven't really had a chance to share questions or concerns.
Yeah, 100%. I think I'm constantly working on my communication skills. And so hearing you say some of those questions, definitely I'm going to start implementing those more. It's a constant improvement in making the patient feel heard. And yeah, it's tough. Dentistry is hard, man. I think it's one of the hardest things to do is diagnose things and make the patients feel like they should get it done, and nobody likes to get dental work done, so it's tough to do that.
Yeah. So I'm going to do a quick exercise and thought process with you through the what I talked about as far as like the ROI of thoughts. So if I am sitting here with Mrs. Jones and I look in her mouth and I see, oh my gosh, she needs like 8 crowns. And I start having the thoughts like, oh, she's going to be overwhelmed. She's probably going to get, I mean, she might get upset. Like if I start, let's pull one thought out of this and say, my thought is Mrs. Jones is going to think this is too expensive. Okay. So that's the one thought. And now let's go through the process, and hopefully you're feeling like we can kind of play with this. If I have this main thought, Mrs. Jones is going to think this is too expensive. What can you think of any other thoughts or fears, or anything that would lead to?
Yeah, for me, a lot of time, if I don't know if this is what you mean, but branching off of that thought, if I don't think they have enough money to do it, it makes it hard to sit there and kind of explain my options to them. Rarely do I have enough time to kind of sit down from square one and talk about their extensive treatment plan. So that is always going through my head, is like, do I have enough time to give this patient the appropriate amount of time to make them feel like they're getting a great experience, make them feel like they're getting my full attention. So that goes through my head with that patient. But
So let me stop you. So some of those thoughts that you just said, um, they are probably going to require more time as far as me explaining things. They are probably going to be more critical of the process and maybe less likely to have a good experience, right? So those are just like a few thoughts. So now if we can go to the next question, after you've said what other thoughts does this lead to, now ask the question, you've taken like these 3 or 4 thoughts. How do those thoughts change your actions? How are your actions in that conversation going to be a little bit different?
right, you're already kind of making a decision that you don't think the patient's going to get the treatment, getting the ideal treatment. So I may not even give them the ideal treatment based off that thought, but obviously every patient's different, and I try to always give the best treatment option. But yeah, I think what you may be getting at is it does show through all of these thoughts that you're having. They definitely show through in your demeanor and the way you talk with patients. Is that kind of what you're getting at?
Yeah, I think, yeah, you have those thoughts, and that leads you, like you said, that may lead you to not even presenting ideal treatment. Um, it may lead you to maybe less confidence. If I'm having thoughts of like, I'm afraid she can't afford it, then I'm probably going to talk differently. I'm going to speak differently when the thought in my mind is, oh, I'm afraid she can't afford it. So then it even changes maybe my verbiage, changes my body language, where I come off as being a little bit less confident. And so if those are, even if they're subtle, those are slightly changing my actions and the way that I'm treating her. And so all of those things combined with those actions, then what results are those actions going to lead to?
Yeah, exactly. You're not getting the results that you, if you sit back and look at it logically, that's not the mental headspace I want to be in for that exam. So controlling, blocking out those thoughts is important. I know we've talked about that before, but
Yeah,
it's hard to do. It's hard to do real time for me.
it is, and like anything else, it's practice. So if I can do that during my normal day, and maybe I have a thought about my wife, that's like, that it's, I can go through that process and I can start to think, oh, I'm thinking about her differently and I'm treating her differently and I'm getting a different result because of all of this thought process that's going through my head. And then that just kind of can basically tell me, oh, I have a bad ROI on this thought. And sometimes it's as simple as that, where if I can make that recognition, then I can kind of like throw out the thought and be like, what's a different thought that I could have about my wife right now? Plug that in and then do the same exercise and then see what results that gets you. It's going to be very different. So it's a habit. It's a process of applying this pattern, going through that on, some of the more simple things, so that at some point it becomes a little bit more like muscle memory. Or with a patient interaction, you may have something like this that happens, and then it, maybe you don't do it in real time, but later on you kind of think, oh, what was my dominating thought going into my treatment presentation? You go through that, you recognize, oh, I think that led to a bad, or a subpar outcome. And so the ROI on that thought is low. And then so you think, you know what? I'm just going to change that thought, and I'm just going to start assuming that Mrs. Jones can do whatever she wants. She's financially able to do, to choose any option that she wants. Then if I run that thought through, it's going to lead to, oh, I'm not worried anymore about what I present. I'm going to be confident. I'm going to be optimistic about it. So I'm gonna treat her differently that way, and then that's going to lead to me presenting ideal treatment, and she's probably going to be more confident and more comfortable in our conversations. And she still may bring up, and she still may say, oh, I'm not sure I can afford that, but she may not. So by just going through that process, evaluate your thoughts and change them, allows you to kind of change your actions, which is just a fun process. So, um, as you have gone through this process, as far as like thinking about your thoughts and, thinking about how they may be affecting other areas of your life, or anything, um, I'm curious to just get your, like, maybe overall perspective. Like, you've spent more time, thinking about thoughts and mindset recently. What's just your overall experience and thought process as far as improvement in that way?
Yeah, and that's the fun part is kind of applying the same principles that you learn in dentistry to your life. And for me, like becoming a practice owner has been, man, it's been really hard, but it has made me a lot better in all aspects as far as just I think being more disciplined and a better leader and what you're talking about, mindsets. Um, for me, I kind of have been applying it to, like I alluded to earlier, I think of myself as a people pleaser and I don't want to upset anyone and I'm a nice guy. And sometimes that will have, I think it's a good overall quality to have, but sometimes I feel like that can hurt you in some situations, whether that be having to lead your team appropriately, hold them accountable, um, having to, not a confrontation, but having to speak up for yourself in certain situations. And it goes off of the same principle that you're speaking to. My initial mindset or my initial thought may be in that situation, like, I don't want to say anything. And I'll use an example from last week. I just bought a new home last year, and we have a building manager checking on us like every 30 or 90 days just to make sure everything has gone well with the home. And he missed his first meeting at 30 days. He just never called, never showed. He just forgot about it. And then at the 90-day check, he showed up, he went over some things, but we did have a few changes that we wanted him to fix. And 2 or 3 weeks had gone by, and he called me last week and he's like, "Hey, Steve, I just want to check on, your home and see if how the house is doing, how the repairs went." And I said, "Hey, the repairs never happened. I was, going to call you soon to see when you think they may get out here to fix it." And he said, "Oh, that's really weird. They should have fixed it by now." And so to me, my thought is like, hey, this guy's definitely not on top of it. He missed his first meeting with us. He had his second meeting with us. It felt kind of rushed and the repairs never got done. And now he's calling me to check on it. So he doesn't even know if the repairs were made or not. So I kind of have this negative opinion of him already. And then at the end of the call, he asked me if I would leave him a survey for, like a 5-star survey, kind of like we do with reviews. He wants a survey, and I guess he's paid off how well the surveys are. And like normally I would just say, yeah, yeah, sure, no problem, and hang up, right? It was during a work day. He called me at like lunch and I picked up, and normally that's my initial thought. It's like, I just don't want to get into it with this guy. When at my real thought in my head is like, man, I can't believe this guy's asking me for a survey. He missed his first meeting. He came to his second meeting, didn't fix anything yet. Nothing's even fixed, and he's asking for me to leave him a survey. So I think I had time over lunch that day, and I've been practicing to try to silence those thoughts, like you mentioned in the dental exam. It's the same muscle in my mind, right? It's when someone comes in and I'm trying to fight back these initial urges or thoughts. My initial thought was like, let's just hang up and let's be done with this conversation. But I said, you know what? I think I'm just going to be transparent with him and say, hey, Tyler, like, honestly, I can't leave you a survey because you haven't done anything for me yet. You haven't done the repairs yet. So once you repair the pavers, then I'll send in the survey. And he got kind of defensive, and he was like, "Oh, well, I guess I better get out there and repair the pavers then." And I think he took it in a negative way, but in reality, I was just saying, "Hey, like, I can't give you a survey until you actually do something for me." So just practicing those things and changing my mindset on those things. And those little things seem stupid, but in the grand scheme of your life, going out to dinner and your steak isn't cooked correctly. I was listening to a Darren Hardy podcast, and Darren Hardy's like this motivational speaker for people who don't know, or a coach. And he had a podcast, and what actually made me start to think about this more in conjunction with your coaching, but I listened to a podcast of his, and he talked about speaking your mind and getting what you want out of life. And if you go out to dinner and you're paying, $100, $200 for the entire dinner, or for a nice steak dinner, and your steak isn't cooked correctly, like, you should be able to speak your mind and get what you want. And if you don't, Is it a negative representation of yourself? Are you saying to yourself, I don't deserve this steak. I'm paying for it, but I don't deserve it exactly how I want it. And I get it. It's one thing if you don't want to wait for them to take it back and cook it and bring you a new one. I get that, but I think it also is a tool uh, that you can develop, or a muscle that you can develop to help you in life kind of get what you want. And I always love the quote that Mark Costa says. I'll probably butcher this, but he says, you are as successful as as many difficult conversations you're willing to have. And I've always loved that, because it's hard for me to have a difficult conversation. I know it's hard for a lot of people to have those conversations, but I believe it's the same muscle in your head fighting through it and saying, you know what, I need to have this conversation with this employee or with this patient. And I believe all of those things are kind of linked together. And I've always enjoyed kind of learning about mindset and some of the things that you talk about and limiting beliefs. And I've always believed that you can kind of change your, I guess, mindset, or the way that you think. You may not be able to change the way that you think, but you can control what you do and the actions that you take. Um, Even if you continue thinking that same way of like, I don't want to speak up, I don't want to create a confrontation, you can still control whether or not you actually do it or not. And usually it feels good if you actually speak up for yourself and stand up for yourself. And so, I know everybody's different, and that's just something I've noticed in myself. And I think that's the hardest part, is the first step is kind of realizing, okay, like, what can I work on? Figuring that out is hard. And once you realize that, you're able to kind of work on it. But uh, just interesting stuff that you can carry from dentistry to real life, and how it can affect you in the rest of your life. And I think the earlier you figure those things out, the compounded effect you can have on your life.
Yeah, I totally agree, and I love that you pointed that out. And I think that's one of the most rewarding things when you can work on something. Maybe I think because we're all practice owners, and that's where we see or relate to so much of our success, that we pay much more attention to it than probably other areas of our life. So if there's something that we're falling short on in our practice, like, we want to know about it. And sometimes it can highlight areas. And then if you can really focus on them and improve them, you start to see it playing out into other areas of your life, like you're talking about with difficult conversations, with, evaluating your thoughts. You start to do that in certain scenarios, and you get good at it. Then you start to do that in other areas of life, and you start to see the benefits of it. So, and I think that's a perfect example with what you're talking about with the home guy, with just being willing to speak your mind, and not pushing it away and just kind of like rolling over, but just saying, you know what, I can be honest with him, and it doesn't mean I have to be a jerk about it, but I can be honest and give him the feedback, and we can move forward. So, yeah, and this is like we talked about last episode with leadership. It's just a lot of these things are things that we can basically be working on for the rest of our life. We're never going to be perfect at any of these things, as far as our thoughts, or our communication. But in some ways, I think that's kind of a beautiful part about it, is that the point is not to reach perfection at any one of these things. The point is just to play the game. It's just to be in there, keep evaluating, keep growing and improving. And I think that's what makes a lot of life enjoyable. um yeah, I think if we're kind of going to wrap up there, I think that was a really good conversation. Is there anything else that you had thought of, or you wanted to talk through, when it comes to mindset, thoughts, communication?
No, not at the moment. I'm sure things constantly come up that I'm working on, and I think reading has helped me kind of realize some of those skills and what need to be worked on, but not right now.
Yeah, yeah. Well, this was a lot of fun to talk through, and I appreciate you for being open and being willing to talk through a lot of these things, because it does take I think you mentioned it. It does take self recognition. You have to be able to kind of step back and, I may be able to kind of point some things out or ask some questions, but unless you're willing to kind of take a look inside and see how to improve, you're just not going to get there. And it's been a lot of fun working with you, and I'm excited to continue to see where your practice goes. So thanks for your time, Steve. And again, we'll put your email in the show notes if anybody wants to reach out to you. But appreciate your time.
Thanks, Derek. Have a good one.
Sicker than your average, sicker than your average. Sicker than your average, sicker than your average.